My name is John Erickson. I'm a nurse practitioner with Palliative Care. I've been a nurse practitioner here at Logan Health for 11 and a half years. Palliative medicine is a medical specialty that deals with helping people that have chronic, potentially life-limiting disease throughout their journey. So helping people not just that have terminal illness, but chronic illness like congestive heart failure or COPD or ALS, certainly cancers, dementia, those kind of illnesses that people have that potentially are life-limiting, whether that is limiting in the length of their life, which is certainly one way to define life-limiting, but also in quality of life and depth of life, which is another way. So we support people in those areas. Hospice and palliative care are often linked together, and people think that they're kind of the same thing. And they're similar and they're related in that hospice is part of palliative care, but it's not all of palliative care. Kind of like all ducks are birds, but not all birds are ducks. So the overarching criteria for hospice is if a person's illness trajectory is reasonable to think that they could have less than 6 months of life if it goes along an expected course and there's limited treatment options, then hospice is available. Palliative care goes far beyond the 6 months, and we help people walk through their illnesses for years, and any treatment is available for that. So they're very closely linked, but they're not the same thing. Anybody can receive palliative medicine if you have, serious chronic illness. Anyone who has the illnesses themselves, or if you have a family member that has those kind of illnesses like CHF, serious heart disease, serious lung disease like COPD, emphysema, cancer, neurologic diseases like multiple sclerosis or ALS or dementia. Anyone can receive palliative care. And it's very easy to access. You can either ask your primary care provider or a nurse to put in a palliative care referral, or you can just call us directly at 406-751-6725 and ask for a palliative care consult. Team members that make up the palliative care service, typically you have board certified physicians that are trained and certified in palliative medicine, advanced practice providers that are skilled and trained in palliative medicine, registered nurses. We also have social workers that are trained and skilled in managing chronic and complex care management issues, and spiritual care specialists. In the hospital, here at Logan, we have all of those. In the clinic, we don't have access to spiritual care specialists as an outpatient. However, it's an easy referral to make. And so it really is a holistic approach that takes a lot of different disciplines and different people being able to approach someone's care so that it's not just kind of one perspective and one opinion. Palliative care benefits patients and their families through 4 main areas that I see. The first area that we help people in is in pain and symptom management. With our service, we focus mostly on cancer-related pain and not chronic pain. We help people with nausea, vomiting, bowel issues, fatigue, depression, anxiety, respiratory issues, appetite, sleep. And kind of the way I see it, and it may sound simple, but it works for me. Each one of us has just a very limited amount of energy that's available to us each day. And if you have to use the vast majority of your energy to deal with those symptoms, you're not going to have the energy needed to give to the people and the relationships and the activities that are most important to you. So through pain and symptom management, which we're very, very good at, the goal is to give you a measure of that energy back so you can put it where it means the most to you. The second area that we help people in is in prognostic awareness, which is a great title. But the idea is looking at really what is the big picture issues and focuses of a person facing chronic illness. Not just maybe their specific illness that they're focusing on, but what are the big picture issues? What are their hopes and what are their fears? Because hope and worry, hope and fear, they're not mutually exclusive. They can be fully present in the same moment. We also help people look at when is it going to be the appropriate time to get hospice involved when it is needed and wanted. The third area that we help people in is in advanced care planning. looking to make sure that everybody has a power of attorney or someone they trust to make decisions for them if they can't make them for themselves or they can't communicate those decisions. We help people walk through the advanced care planning packet, living wills, helping people decide and be able to communicate what they want, and I think more importantly, what they don't want in the event of an emergency. We also help people walk through and fill out a POLST form, which is the Provider's Order for Life-Sustaining Treatment, sometimes referred to as a DNR, but that's only part of it. The big part of that is, it's really important for me as a provider that the people I meet with, they get to be the captain of their ship. This is their life. And eventually, one day, it's going to be their death, hopefully further down the road. But I want to make sure that people are able to have as much say in that as possible. And then the fourth area that we help people in is in psychosocial and spiritual support. John Erickson paraphrase, what gives you joy and what brings you comfort and peace on your journey? Are you a religious person? Are you not a religious person? Are you spiritual or not? Do you belong to a faith community? Do you belong to a civic community? Do you have good family support? Do you have good friend support? What are the things that really you enjoy doing, and how can we best support you in that? And so those are the areas that we help people in, and I think people can really benefit from. There are a lot of medical issues that people are dealing with, and they can be overwhelming. Our goal is to help you and your loved one have the best day possible. Feel free to reach out to us. We would love to come alongside and support you. Again, you can reach out to us at 406-751-6725, and we would just be happy to meet with you.